A common question we hear is, how does Medicare work? It can be confusing, but here are the basics. Medicare is the federal health insurance program for people who are 65 or older. It's also available to younger people with certain disabilities, people with end-stage renal disease and amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease. Medicare has 4 parts: Medicare Part A, hospital insurance; Medicare Part B, medical insurance; Medicare Part D, prescription drug coverage; and Medicare Part C, Medicare Advantage, offered by private insurance companies. Medicare Part A and B are generally referred to as Original Medicare. So, to understand how Medicare works, let's talk about Original Medicare. Original Medicare is different from other forms of major medical health insurance, like the health insurance Americans get from their employer. It's different in 4 key ways. The first thing that is different about Original Medicare is that it covers hospital care and medical care separately. Part A is the hospital insurance. Part A generally covers you when you're admitted to a hospital, skilled nursing, or nursing home facility, or when you receive hospice care or covered home health services. Part B is the medical insurance. Part B generally covers medically necessary care that either diagnoses or treats a medical problem, like the flu, in an outpatient setting such as a doctor's office. Part B also provides care aimed at preventing or detecting illnesses at an early stage. The second thing that makes Original Medicare different from other forms of major medical health insurance is that it doesn't limit your out-of-pocket medical expenses. Out-of-pocket medical expenses are charges you have to pay yourself. Those charges include things like co-payments, deductibles, and co-insurance. One example is when you're admitted to the hospital, Part A has a deductible. After you're released from the hospital, that deductible can reset after 60 days. An example of Part B out-of-pocket costs is that you'll have to pay 20% of approved medical costs after you pay your deductible. The third way that Original Medicare is different from other types of health insurance is that it doesn't cover prescription drugs in most cases. Prescription drug coverage is available through a separate program called Medicare Part D. Finally, the fourth way Original Medicare is different is that it doesn't have standard provider networks. What that means is that the amount you pay to see a doctor can vary, depending on whether or not your doctor participates in Medicare. A common question we hear is, does Medicare cover prescription drugs? Great question. Original Medicare, or Parts A and B, offers limited prescription drug coverage and does not cover most medications you take at home. In most areas of the country, you will have the option to get your Medicare Part A and Part B coverage through Medicare Part C, also called Medicare Advantage, which is a private health insurance policy that covers all of your Medicare benefits in one plan. Most Medicare Part C plans include prescription drug coverage. If you do not enroll in Medicare Part C, you can get prescription drug coverage by enrolling in a standalone Medicare Part D plan sold by Medicare-approved insurance companies. Once you're enrolled in Medicare prescription drug coverage, medications are covered as long as they meet these requirements. Number 1, they must be approved by Medicare. Number 2, they must be on your plan's formulary. A formulary is the list of medications your plan will cover. And number 3, the medications must be prescribed by your doctor. A common question we hear is, does Medicare include dental insurance? Here's the simple answer. Original Medicare does not cover dental care, such as teeth cleanings, fillings, dentures, or root canals. The next question is, when does Medicare cover dental treatments? Original Medicare may pay for dental services that are medically necessary prior to another Medicare-covered medical procedure, before you can get another, more serious procedure like a surgery. For example, Medicare might pay for a tooth extraction if it is required before heart surgery. Or a person with oral cancer might get a procedure covered prior to radiation treatment. Even if Medicare does pay for some services as preparation for a medical procedure, it will not cover the cost of implants or dentures. Now the good news. Dental coverage, vision coverage, or support for hearing loss is available in some areas of the country through Medicare Advantage plans. If you're considering a Medicare plan that does not provide routine dental and vision, you can also research standalone dental and vision insurance plans. A common question we hear is, what does Medicare Part C cover? Medicare Part C is typically referred to as Medicare Advantage. These plans are offered by private insurance companies that contract with Medicare as an alternative way to get your original Medicare, Part A and Part B. Many Medicare Advantage plans also include Medicare Part D. But keep in mind that not all plan types are available in every area. The benefits on these plans can change from year to year, so you have the option to change your Medicare coverage every year during Medicare's Annual Election Period, or AEP. Medicare's Annual Election Period runs from October 15th to December 7th each year. With Medicare Advantage, you may pay little or nothing for doctor visits, hospital stays, prescription drugs, dental care, eyeglasses and contacts, and fitness classes. In addition to your Medicare Part B premium, some plans, but not all, require an additional monthly premium for the Medicare Advantage plan's medical and prescription drug coverage. Medicare Advantage plans may be available in your area for a $0 monthly premium, regardless of your income. Here's a list of the types of Medicare Advantage plans. Health Maintenance Organization, or HMO. Preferred Provider Organization, or PPO. Health Maintenance Organization Point of Service, also called HMO POS. Private Fee-for-Service, PFFS. Special Needs Plan, SNP. Medicare Savings Account, MSA. A common question we hear is, what is a Medicare supplement plan? Medicare supplement plans are sometimes called Medigap plans or MedSup plans. Offered by private insurance companies, they're intended to help you pay your portion of copays, deductibles, and coinsurance that Medicare Part A and Part B do not pay for covered services. These are costs Original Medicare expects you to pay out of your own pocket when you use your coverage. With a Medicare supplement plan, you can visit any doctor or hospital that accepts Medicare patients. There are no networks or referrals to see a specialist. And Medicare supplement plans can also cover certain medical care when you're traveling outside the United States. Medicare supplement plans may be a good option if you prefer a steady, predictable monthly payment as opposed to paying out of pocket when you need unexpected medical care. Don't confuse Medicare supplement plans with Medicare Advantage plans. Medicare Advantage is another way to get your Part A and Part B and usually Part D coverage in a single plan. You cannot have Medicare Advantage and Medicare supplement coverage. And with a Medicare supplement plan, you still need a Part D prescription drug plan. It is possible to switch from original Medicare or Medicare Advantage plan to a Medicare supplement plan. But to cancel Medicare Advantage, you'll typically need to wait until Medicare's annual enrollment period, which runs from October 15th to December 7th. And if you apply for a Medicare supplement plan after your initial enrollment period, your application for coverage is not always guaranteed to be approved. In some states, your application may be subject to medical underwriting. That means you may pay more for coverage or your application may be declined. Remember, with a Medicare supplement plan, you'll need to buy a Medicare Part D prescription drug plan separately. Once you understand how Medicare works, you'll be better prepared to sign up for coverage and select the right type of Medicare plan that meets your needs when it's time to enroll.